Hi, my name is Jordana Guillén. I'm studying medicine at Catholic University. My topic is about a case 22-2016. A 65 years old man with syncope, dyspnea, and leg edema. Definition about the case. Syncope is temporary loss of consciousness and posture. It's usually related to temporary insufficient blood flow to the brain. Dyspnea refers to the sensation of difficult or uncomfortable breathing. It is a subjective experience perceived and reported by an affected patient. An edema is a medical term for swelling, body pores, swell from injury or inflammation. It can affect a small area or the entire body. There is a video about dyspnea and syncope. Continue with the case. We have applications in medicine. The patient had been in his usual health until approximately 1 month before admission, when cough occurred. 1 week later his legs became swollen and weeping sores developed. Dyspnea on exertion without orthopnea developed and was associated with a weight gain of 7 kilograms. The patient was seen by his primary care physician or another hospital. There's a video about the topic.
Dyspnea is shortness of breath. It's a very common symptom in a lot of illnesses and conditions. People think of COPD or interstitial lung disease or pulmonary hypertension, but it can also go along with conditions like heart failure and cancers. And really, there can be so much suffering that goes along with the shortness of breath. It causes anxiety and depression and dependence on others for help around the house and doing errands, and it just can make people feel so terrible. What amazes me about a lot of patients I meet with advanced lung disease is how accustomed many of them become to the limitations of their breathing. Some of them become very used to walking 10 feet and stopping and resting, and they at least tell me sometimes that it doesn't bother them, and some people it does bother. So really it's taking a very personal, very patient-focused approach to how does it affect them, and how do we help make it better.
The pros and cons. In pros, by observing heart rate before, during, and after syncope, the physician can identify whether the cause of unexplained syncope is related to the heart. When the patient usually has dyspnea, difficult in meeting the needs of oxygen, usually immediately notice their breaths and try to control the frequency and depth. And cons, syncope could be the first sign of heart disease or stroke, and doctors often difficult to determine exactly what caused a first episode of fainting. The patient with dyspnea has anxiety and inability to control basic function for life can be frightening, because anxiety breathlessness may further worsen the situation. Issues apply inequally. A 65 years old man presents with syncope 1 month early called dyspnea and leg edema has developed. Imaging studies of the chest revealed lymphadenopathy and a echocardiogram showed hypertrophic obstructive cardiomyopathy. A diagnostic procedure was performed. There is a video about the diagnostic.
The heart is a beating muscle that continually pumps blood to the lungs and organs of the body. Inside the heart are 4 chambers, 2 upper chambers or atria, and 2 lower chambers or ventricles. The ventricular septum is the muscle which separates the 2 ventricles. Hypertrophic cardiomyopathy, HCM, is a genetic heart disease where there is increased thickness of the left ventricle, predominantly affecting the ventricular septum. There are 2 types of HCM, non-obstructive and obstructive. Obstructive HCM occurs when the mitral valve makes an abnormal motion and contacts the thickened septum, obstructing the flow of blood from the left ventricle out of the heart, as well as causing leakiness, or regurgitation, of blood back into the left atrium. This obstruction to blood flow and mitral regurgitation creates high pressures in the heart and is the main cause of limiting symptoms in patients with obstructive HCM. Symptoms may include shortness of breath with exertion, chest pain, dizziness, or exertional fatigue. Although there is no cure for HCM, there are several effective treatment options available to improve symptoms.
In conclusion, the patient has done well after cardiac surgery. He's been monitoring in both the sarcoid clinic and the hypertrophic cardiomyopathy clinic at this hospital. The final diagnosis is sarcoidosis, involving the heart and thoracic and inguinal lymph nodes. Therefore, the above symptoms presented by the patient in the clinic case demonstrate. There is a video about the topic, sarcoidosis. Thanks for watching the video about the case.